The Table Talk podcast, where no discussion about the dinner table is off the table.
Hello everyone, welcome to the fourth episode of EDAC's Table Talk podcast. I'm Kyle Buchan, the research assistant at EDAC, and today I'll be talking to Luka White about autistic, trans and non-binary people's experiences of eating disorders. We'll be covering eating disorder development, treatment, recovery and research priorities. Really hope you enjoyed today's session and thank you so much for tuning in. Hi Luka, thank you so much for joining me today, really happy to have you here. I guess before we start today's session, it'd be really great if you could just introduce yourself to everyone listening and maybe tell us a bit about your own research.
Hi. My name's Luka. Luka White is my full name. I use they, them pronouns, and I am a researcher at the University of Edinburgh, where I'm studying my PhD on disordered eating in people that are trans, non-binary, and autistic.
Amazing. Great. So obviously that's kind of why we're here today, to kind of really delve into that topic, or as much as we can, on kind of the limited research out there already. So my first question, easy one, what do we know about the prevalence of disordered eating in autistic, trans and non-binary people as of yet?
So what we know with more certainty is that rates of disordered eating and eating disorders are particularly high in autistic people. We know that they're particularly high in trans non-binary people, and we know that a lot of people are both trans, non-binary and autistic. What we don't know for sure yet is whether autistic, trans, non-binary people are especially prone to disordered eating and eating disorders. We sort of suspect this is the case based on the very limited literature we do have. So one study based in Australia found that 52.3%, I think, of the autistic, trans, non-binary young people that they surveyed reported an eating disorder, which is obviously really, really high. The only other study to look at it found the prevalence to be 10.1%, which is still high, but quite a bit different from 50%. So we kind of need more data to be able to say for sure.
Yeah, like you said, that's obviously quite a big discrepancy, but at the same time, both extremely high compared to kind of the total population. So yeah, definitely needs to be more prevalence research there. And you kind of mentioned about, obviously you said about that kind of intersection, how kind of both identities separate, so autistic and trans non-binary are both kind of more at risk of developing eating disorders, and then at that intersection, you know, there's the possibility that it could be even higher prevalence. So I guess on that, what kind of motivations or triggers for eating disorder behaviour do you think are kind of unique or are particularly important for autistic, trans and non-binary people?
Well, at the moment, it's quite hard to know what the kind of most common motivations or triggers might be because the area is so under-researched. But it's one of the areas that I'm asking questions about in my PhD. One kind of sort of simplistic way of thinking about it might be to think, okay, autistic, TNB, or trans non-binary people have are exposed to the triggers that the general population are exposed to, plus specific triggers related to being autistic, plus specific triggers related to being trans. So kind of like classic example, which appears in the literature to a certain extent, is like a young person who's exposed to appearance pressures saying that girls should be thin and so eat less. Plus they have like reactions to the sensory properties of food, so they eat less. Plus they have gender dysphoria, so they stop eating in order to change their body, their physical body, or delay puberty. And that kind of all pushes them towards an eating disorder, a restrictive eating disorder. I think it's a very simplistic way to think about something as complicated as human experience, to kind of say it's like A plus B plus C equals D. So I think in this PhD, what I'm really interested in is applying a sort of like intersectionality theory lens to this. So what is it? How do being autistic and being TNB interact to create unique experiences that might lead to more disordered eating? What is the kind of role of the social context around them on their disordered eating? What is the role of discrimination and prejudice? Because being autistic and being TNB are both like marginalised minority groups in the UK. So what is the role of kind of discrimination and prejudice on autistic TNB people's disordered eating?
Mm-hmm.
I guess I have like some hypotheses around what some of those intersectional unique factors might be, but they're very much like in the hypothesis stage. A lot of it, I imagine, a lot of them come from my previous research, which is in autistic TNB mental health more generally. But I think a lot of it might be to do with kind of this feeling of society is what we say neuronormative. So there are like specific norms around how your brain and mind should function, and cisnormative in that there are specific ways that you should kind of do gender. And this might lead to autistic TNB people feeling like very different or other from a young age. And then having a lot of confusion or distress as they try and work out, okay, in what ways are society saying that I'm different or other, and what does that mean for me and my identity? And this like complex feeling of being different in multiple ways and how to navigate that, and then feeling maybe out of control of one's life and one's body. I'm kind of expecting that to be an intersectional experience.
Mm-hmm. No, definitely. And I mean, I think the word like complexity, I think kind of sums it up, like with all these different factors. And like you say, you can't, there's not a simple kind of one size fits all, diagnosis or approach to these experiences. And on a similar vein, then I was kind of going to ask you about like what we know about the experiences of autistic, trans and non-binary people in eating disorder treatment. So kind of once they've got into that treatment stage, if we know anything about their kind of experiences, maybe how effective treatments are or ineffective, or maybe talking about those heteronormative and kind of neuronormative I guess systems, if maybe that kind of works against autistic, trans, non-binary people in treatment.
Yeah, so again, we know that autistic people face some specific barriers to in eating disorder treatment settings, and we know that trans non-binary people also face specific barriers in eating disorder treatment settings. What we don't know so much about are the experience of those who are both. What we do know from like the one case report with three, it was like n equals 3, around autistic trans people with eating disorders, is that autistic trans non-binary people require often like multidisciplinary support with their disordered eating. So they might require like the input of an eating disorder clinician and a therapist and a dietitian, but they might also need access to gender affirming healthcare if gender dysphoria is like a really big driver for them. But one of the problems with the healthcare services as they stand is they're often sort of siloed. Like you can get autism support from an autism service, trans support from a trans service, and eating disorder support from an eating disorder service. But a trans autistic person with an eating disorder who presents, maybe to healthcare for the first time with their eating disorder might require care from each of these services, preferably all at once. But each one has a waiting list, each one has gatekeepers, and at each one they might face different barriers to accessing that service. So I think what we can guess at is that they require this multidisciplinary support, but that accessing that is complicated.
Mm-hmm.
We can also sort of guess that support might work best if it's like individualized to that person. So sort of generic like a generic therapy package aimed at like increasing body positivity might not work so well if someone is experiencing a lot of gender dysphoria. But a kind of good therapist in that setting might be able to tailor that intervention to work best for the individual in front of them. And similarly, like a group treatment setting, group treatment we know can be a barrier for some autistic people, especially like unstructured therapy groups can feel quite hard for autistic people. But then sometimes they're split into men's groups and women's groups, which makes it quite hard for trans and non-binary people to access them. It doesn't mean to say that group treatment or individual treatment won't be helpful for autistic, trans, non-binary people. Like, undoubtedly, like a lot of ED treatments would be really helpful for people. It's just that those treatments might need to be tailored slightly or flexible in some ways, so that the autistic, trans, non-binary people don't end up being excluded from accessing that service.
No, definitely. And what you were saying before about that's kind of the gatekeeping and the separation between kind of services is definitely something that we've heard before, even outside of kind of trans and non-binary, but just like with being autistic and having an eating disorder, they kind of go to like autism services and say, oh, we don't know how to deal with an eating disorder, and they go to eating disorder service and say, oh, you're autistic, you're too complex for us, you know.
Exactly.
And it's definitely, and obviously that's kind of not at a service level, but obviously what EDAC is kind of trying to do is bridge that gap between the two and kind of see how can we make this work, how can we integrate this like further down the line. And yeah, so I definitely think that's a really important issue to raise. So kind of staying kind of within treatment, I guess, given that, you know, we don't know too much in terms of numbers or, you know, treatments that work best, but just at kind of a really basic level, what piece of advice would you give to a clinician working with autistic, trans, non-binary people, and why? You know, what do you think a simple thing that they could do to kind of make that experience better for the autistic person?
I think something you just brought up is where I would kind of go with this, is that just being a bit wary about this kind of autistic, trans, non-binary people are too complex to support idea.
Mm-hmm.
We know that autistic people have had this experience of being told that they're too complex or too difficult. We know that trans, non-binary people have had this experience of being told they're too complex or too difficult. We then suspect that this will be like multiplied for autistic, trans, non-binary people, right? So I think if you're working with a autistic, trans, non-binary people and there's a little like voice in your head that sort of starts worrying and going, oh, this person might be too complex for me to support, that's really understandable, but also you kind of need to sort of slightly put that to the side and make sure that you're focusing on the person as you would any other person, and not kind of like reducing them to their complexities, like seeing them as a whole person, and kind of like respecting their identities and experiences will be an essential part of that, right? So respecting their trans non-binary experience, respecting their autistic experience, and just being open and curious and like willing to learn, and flexible and creative in thinking about how to make ED treatments like more accessible for people. Because I think that's the thing when faced with someone that your brain is going, oh, maybe this person is too complex. The kind of way to go then is to go towards creativity and think creatively about how that person could be included in the ED treatment settings, or if there's a way that you could individualize support for them. So yeah, I really understand this like knee-jerk, this person is really complex response, but I do think that we need to be wary of that clouding the rest, like the support that they're able to access. Otherwise you just end up with people falling through the cracks. and not ending up getting any support because they're being told by every service that they're too complex for it.
Yeah. Yeah, no, again, that's kind of very interesting and something that's kind of come up in our previous work at EDAC as well. This, and I think it is a really difficult line to toe actually in terms of accounting for an autistic service user, for example, and the kind of the different approaches that may need to be made compared to like a neurotypical person, for example. However, not just viewing them, oh, they're autistic, that means that this will work for them, it is a fine line between getting that individualized treatment, but also, I guess, recognizing that there might be some frameworks that would be useful for autistic people, but yeah, to not over assert that. And I guess just a follow up question, and if you don't have an answer, then we can just move on. But I just thought it was interesting when it came up on a similar line. A thing similarly related is this kind of concept of untangling that we've heard before. And specifically, it was in the context of autism and eating disorders. So there's been a big kind of polarization between some people who think, yes, you can untangle me being autistic and my eating disorder. But there's also been people that have said, no, you can't, because like the eating disorder is intrinsically me. So there's it kind of seems to be, if people view their eating disorder as like an external mental health issue, or if it's like kind of a part of their identity, is where that comes in. And I guess I just wanted to get your thoughts on where you think kind of trans and non-binary identity also comes into that, in terms of, you say like kind of accounting for trans and non-binary, maybe for example gender dysphoria in treatment, but can we untangle, say, trans and non-binary triggers or drivers, and then potentially autistic triggers and drivers in that same person? And I just wanted to get your thoughts on that, because I think that's kind of an interesting concept.
Yeah, it is really interesting, and it kind of goes back to what I was saying earlier about this kind of like thinking about it as autism plus trans plus general population equals eating disorder, like in terms of triggers, being quite, like, I find that quite simplistic. And although I think there are some situations where it's useful to break down like people's triggers or maintenance factors into what is driving them. But I think there's a kind of risk in my PhD, for example, of falling down this trap of being like, oh, these are the trans-related triggers and these are the autism-related triggers, because we know that it's so much more complicated than that. For example, like, say you have a young trans person who is autistic and they want to be thin. They might not know why they want to be thin. They might have experienced appearance pressures from society saying you should be thin, thin is good. But they might have also experienced appearance pressures from within the trans community saying thin is good, because within the trans community there's this like very unhelpful assumption that to be androgynous is to be thin, and some trans people and the wider people want to be androgynous. So there's a sort of the appearance pressures happen at two levels. And then can you untangle someone's gender dysphoria, like how they intrinsically think about their body, from these appearance pressures? Like, and is it helpful to do so? So I think it's really important to think about gender dysphoria as an important driver for some trans people's eating disorders, but not to centralize it to that. A bit like you were saying earlier, with autistic people and and clinicians saying that autistic people, you can't kind of like say one size fits all. I'm going to make this one accommodation and suddenly the service is great for autistic people. That won't work. Similarly, with a trans person, you can't say, well, it's gender dysphoria is the driver, and therefore that will and so therefore gender affirming healthcare is the solution, and we can pass them over to a gender affirming healthcare service, and that will solve their eating disorder. That will work for all trans people. Don't know if I've quite answered your question.
No, absolutely. I mean, it was not even necessarily a question. It was more to just kind of get that out there, because I think it's just an interesting topic, and I think it's definitely something, like, if anyone's listening that wants to research that, I think it'd be good at exploring that, kind of how autistic, trans, and non-binary people kind of feel about this kind of concept as well, just to get that kind of lived experience perspective. But no, thank you. That was definitely a good answer. So I guess moving kind of post-treatment then, and thinking about recovery, kind of in terms of everything we've said so far, what do you think that recovery could potentially look like for autistic, trans and non-binary people? And could this potentially look different to, say, just an autistic person who's not trans or non-binary?
It's definitely something that I'm curious to find out in my PhD research. I think the kind of like trans-specific elements to it is going to be a lot for people about like being affirmed in their identity. So that might be social or medical transition, but this sense of being kind of like affirmed and accepted for who you are, I think will be really important for autistic, trans, non-binary people's recovery. And it's possible that there'll be a role of kind of community connectedness, so people kind of like finding their community, finding their people, maybe other trans, non-binary people, maybe other autistic people, maybe other people who are both, and kind of receiving community care and support might be really important for people's recovery. Beyond that, it's really hard to say. But I think it's important that we don't really know, kind of like, we know that autistic people and trans people separately might have more chronic eating disorders, might struggle more with kind of following a linear recovery, if that, however possible that is generally, like, but they might struggle more with that. They might have more chronic presentations. But we don't really know about this intersection at all. So I think it's really important. Recovery is one of the really important things to research moving forward.
Definitely. I suppose, because that is the end goal at the end of the day, is we want people to recover and to kind of live authentic, healthy lives for themselves. So I know this again might be difficult to answer, just like you say, based on this kind of current lack of research. But I suppose maybe if I reframe it then to what potential additional barriers do you think could come into play in terms of when we're thinking about autistic, trans, and non-binary recovery? Is there anything that kind of comes to you in that sense?
Two things, I think. I think the first thing is this thing we were talking about a little bit already about treatment barriers. So let's say a person does have gender dysphoria as one of the drivers for their eating disorder. And there's some research that says like autistic, trans, non-binary people might experience gender dysphoria slightly differently or even more intensely in some ways. So let's say an autistic, trans, non-binary person who experiences gender dysphoria would really benefit from gender affirming healthcare. And so they go to an ED clinician, the ED clinician refers them to a gender service, but then what if they sit on that waiting list for 7-8 years? That is going to be a barrier to their ED recovery. Like, no matter, what's going to happen to their eating disorder in those 7-8 years. So I think treatment barriers will be a common barrier that people kind of report. And then I think the other thing is the kind of ongoing nature of some of the triggers. So, for example, if one of the triggers for disordered eating is feeling out of control in the current transphobic political climate, the political climate isn't something that can be changed with an individualized intervention, right? And it's something that might persist for quite a while. How do you sustain recovery if you're kind of hearing about or witnessing transphobia all the time and that's impacting your disordered eating? It kind of comes back to that question of how much can you expect an individual change if the conditions around the individual aren't changing? So I don't want to kind of be too negative about this. Like, I do think that people are extremely resourceful. And one of my favorite quotes from a piece of research about trans autistic experiences was people were saying, you know, our existence is rebellion. They said existence is rebellion. They really found like the resources in themselves to recover from, in that case, like other mental health conditions. So I really don't want to be too negative about it, but I do think that there probably are these other barriers to recovery experienced by autistic trans non-binary people.
No, absolutely. And yeah, I mean, I get what you're saying about not being too negative, but I think sometimes it's hard to potentially like try and put a positive spin on some things. So, but no, I think that's a really good point. And I guess lastly, to kind of just wrap up, I know like to cover everything we have spoke about, like, you know, some barriers and things that we don't just know enough about to kind of make impactful changes within services at the moment. But what do you think is like an absolute research priority in this area that kind of we need to know soon? Is it to do with recovery? I know you mentioned earlier that was kind of recovery was obviously so important, but yeah, what would you say is kind of your research priority that you'd like to see more people kind of get into?
There are so many things that I think that we should research on in this area. If I had to like pick out one priority for research, I would say that whatever research is done, that it is co-produced with the community, that trans autistic people have had enough research done kind of to them and without them in the past, and that they should be involved in the research, you know, in whatever way is most suitable for that project. But, you know, at the minimum, kind of like at an advisory level, to kind of make sure that the research follows their priorities, and isn't going to be kind of written in a way that is sort of harmful to the community, because I think that does happen sometimes as well. I could talk for a lot longer than we probably have about the different research that I would love to do in this area. My PhD is about, the first study that I'm doing at the moment is about understanding the lived experiences of trans autistic people with eating disorders. So that's very much like a trying to establish the answers to some of these questions that we've had today, from the lived experience perspective, like looking at the drivers, the maintenance factors, what treatment experiences are like, what recovery is like. And so I'm really excited to be doing this piece of research as my first study.
No, I definitely agree. I think we could probably, maybe we'll get you back in for just an episode just to talk about that further down the line. But yeah, thank you so much, Luka. This has been super interesting, and I'm sure people listening have found it really informative as well. I know I have, as kind of someone that hasn't necessarily delved too much into like the trans non-binary literature within eating disorders, so it's been kind of really helpful for me as well. So yeah, thank you so much, and yeah, like I say, hopefully maybe we'll have you back on another episode at some point.
Thank you for having me. Yeah, maybe further down the line when we know a bit more.
Yeah.
That would be great.
Brilliant.
Thank you so much for listening, everyone. I really hope you enjoyed today's episode. As always, if you have any comments or questions about the episode, or maybe even suggestions for future episodes, then you can contact me on my email address, which is kbuchan@ed.ac.uk, and I'll do my absolute best to implement those. Thank you again and enjoy the rest of your day.